Hello and welcome. Today we're diving into a common, yet sometimes alarming condition, epistaxis, more commonly known as a nosebleed. We'll explore what causes them, how they happen, what to expect, and how to manage and prevent them. So, stick around as we unravel the mysteries of nosebleeds. What exactly triggers a nosebleed? Well, the causes are varied. The most frequent culprit is simply dry air, which can irritate and crack the delicate lining of the nose, especially in winter or dry climates. Other common causes include nose picking, forceful blowing, minor injuries to the nose, allergies, and upper respiratory infections like colds or sinusitis. Less common but more serious causes can involve high blood pressure, bleeding disorders, certain medications like blood thinners, and, in rare cases, tumors. Let's delve into the how of nosebleeds. The inside of your nose is lined with a mucous membrane packed with tiny blood vessels. These vessels, particularly those in the front part of the nose, called Nosebleeds plexus, are quite superficial and easily damaged. When this membrane is irritated, dries out, or experiences trauma, these vessels can break open, leading to bleeding. In anterior nosebleeds, the bleeding usually comes from one nostril and is generally easy to control. Posterior nosebleeds, which originate deeper in the nose, are less common but can be more severe and require medical attention. Nosebleeds are incredibly common. It's estimated that about 60% of people will experience at least one nosebleed in their lifetime. They are more prevalent in children between the ages of 2 and 10, and adults over the age of 50. This increased occurrence in younger children is often due to nose picking and frequent colds, while in older adults, it's often linked to increased use of blood, thinning medications, and changes in blood vessel fragility. The most obvious sign of a nosebleed is, blood flowing from the nose. It usually comes from one nostril, but sometimes can affect both. The bleeding can be light or heavy, and can last for a few seconds to several minutes. You might also experience a dripping sensation down the back of your throat, especially if the bleeding is heavier or located further back in the nose. Less obvious symptoms might include swallowing blood, which can cause nausea or vomiting, and dizziness, particularly if a significant amount of blood is lost. Diagnosing a nosebleed typically involves a physical examination. Your doctor will likely examine your nose using a light and a nasal speculum, which is an instrument that helps widen the nostrils to better visualize the inside of the nose. They'll be looking for the source of the bleeding. In cases of recurrent or severe nosebleeds, or if there's suspicion of an underlying condition, further tests may be necessary. These could include blood tests to check for bleeding disorders, nasal endoscopy to get a better view of the nasal passages, or imaging studies like a CT scan to rule out other structural problems. Nosebleeds are broadly classified into two types: anterior and posterior. Anterior nosebleeds, accounting for the majority of cases, originate in the front of the nose, specifically the Nosebleeds plexus. They are usually less severe and easier to manage at home. Posterior nosebleeds, on the other hand, occur deeper in the nose and often involve larger blood vessels. These are more common in older adults, people with high blood pressure, or those on blood thinners, and they usually require medical attention to control. Most nosebleeds can be treated at home with simple first aid. First, remain calm and sit upright, leaning slightly forward to prevent swallowing blood. Pinch the soft part of your nose just below the bony ridge for 10 to 15 minutes, breathing through your mouth. Don't release the pressure to check if the bleeding has stopped until the full time has elapsed. If the bleeding continues after 15 minutes, repeat the process. If bleeding persists after 2 attempts, or if the bleeding is heavy, you feel weak or dizzy, or the nosebleed was caused by an injury, seek medical attention. Medical treatments may include nasal packing, cauterization, sealing the bleeding vessel with heat or chemical, or, in rare cases, surgery to ligate tie off the bleeding vessel. Preventing nosebleeds often involves simple measures to keep the nasal passages moist. Use a humidifier, especially during dry weather. Apply a saline nasal spray or a small amount of petroleum jelly to the inside of your nostrils to keep them lubricated. Avoid nose picking and forceful blowing. If you have allergies, manage them effectively with antihistamines or other medications as prescribed by your doctor. And if you're taking blood thinners, talk to your doctor about the risks and benefits, and whether there are any adjustments that can be made to minimize the risk of bleeding. The prognosis for most nosebleeds is excellent. The vast majority of nosebleeds are easily managed at home and do not cause long-term problems. However, recurrent or severe nosebleeds can be a sign of an underlying medical condition that needs to be addressed. Recent research focuses on developing new and improved methods for controlling nosebleeds, such as advanced nasal packing materials and minimally invasive surgical techniques. Ongoing studies are also exploring the link between nosebleeds and various medical conditions, aiming to improve diagnosis and treatment strategies.